Well, the national crackdown on healthcare and hospice fraud across the country continues tonight. Today, federal officials announcing that they are pausing more than $1 billion in federal Medicaid payments to California and Minnesota. They also announced that they are expanding the exclusion authority of Medicare, Medicaid, and the Office of the Inspector General. That means that can remove bad actors from federal healthcare programs and ban them from returning.
Our reviews are going back just over the last few years, turned up the same recurring theme again and again, every single quarter. Claims in these same high-risk categories that the states have not yet been able to document fully and acceptably to the federal government. Claims that are unresolved and claims that smell like fraud. And if it smells like fraud, we're not paying for it anymore.
And so far, more than 400 people have been arrested or indicted and accused of defrauding more than $5 billion from the U.S. government.
And right here at home, we remain under an increased hospice oversight as state and federal officials continue investigating concerns involving fraud and patient care standards. As I've previously reported, Nevada paused new hospice licenses while regulators investigate these concerns. And with more than 300 licensed hospice providers right here in Clark County, right now advocates say patients have options, leaving many families to decide what is the best fit for their loved ones. And as I've continued looking into hospice care and concerns right here in Southern Nevada, one issue just kept coming up. How do you navigate those decisions? I spoke to one local family about their experience.
And so when she had her stroke, I brought her to Las Vegas because I believed I would be able to give her more assistance.
When Deborah Johnson suffered a stroke, her daughter Micaiah Davis tells me she brought her from California to Las Vegas to care for her herself.
Yeah, that's her as a little girl.
She is beautiful. Yeah. But not soon after, Micaiah found herself navigating hospice care for the first time.
Now I know, going forward, if I have to take care of my father or any, now I know. But like I'll be taking care of my aunt here shortly. She'll be coming to live with me. And now I know, but I didn't know at that time. And I just feel like my mom was cheated out of a lot of services because I didn't know.
Micaiah says she eventually realized how much the quality of care, staffing, and support can vary depending on the provider.
I didn't know my rights. It was my first time on hospice, and if you don't know, you just don't know.
Without naming the hospices involved, she tells me she saw major differences between the provider she started with and the one she transferred to after just a few weeks.
They didn't have many nurses. They didn't have many CNAs. My mom would miss baths. She would, miss a lot of things. Her medication was late or things like that. It was my first time ever taking care of someone on hospice. So I didn't have anything to compare it to. It was my first company until it was with the new company that I was able to compare, and I can tell the difference.
Amazing.
She has 6 kids.
She says one of the biggest lessons was learning what services families should ask about from the beginning, including the right medical equipment and supplies for a person's hospice situation and the in-home support that they can provide.
The bedding. I didn't have a bed. My mom was sleeping on the couch when I first got up.
Wow.
They were able to give me a bed. They were able to give me a chair, a hospital chair, a hospital bed, a chair for the shower. It's hard, especially for myself. My mother was bigger than me, so I would have to lift her, feed her, change her, and it was hard on me.
Micaiah says her experience raised questions about oversight and accountability.
I would sign off for hours that were not completed. I would do that, and I am ashamed to say that because they weren't, but I knew that they didn't have the resources.
While the company that Micaiah was first working with acknowledged that every hospice can make mistakes, they denied these allegations and said they do not ask patients or families to sign timesheets. As part of my reporting, I reviewed Nevada's ongoing hospice oversight concerns, including the state's pause on new hospice licenses to identify potential fraud and ensure quality of care. Because of that, hospice administrators, clinicians, and healthcare advocates have been meeting monthly, pushing for stronger oversight and more transparency.
Correct.
And your dad's in California
as
well?
Okay.
Correct. They say stories like Micaiah's show why families should research providers carefully and ask questions before making end-of-life decisions for our loved ones.
I didn't know that she was, by right, she had a right to have a medical bed and her insurance paid for it, Medicare or Medi-Cal. You have to ask questions. You just have to ask. But how do you know to ask questions that you don't know?
Yeah. Reporting in Las Vegas, I'm Abel Garcia. Now, I did also reach out to the Nevada Health Authority, and officials say anyone who suspects medical fraud should report it to the Office of the Medicaid Inspector General. Or if you've experienced a similar situation, I want you to please feel free to reach out to me. My email is abel.garcia@ktmv.com.